long does it take for a scar to fade after having a mole, cyst, or lipoma removed? Sometimes we put these clippets a word, isn't it? It's clips of this on Instagram, just with the not on Instagram, on YouTube, just with the clip, and TikTok, and I did one a while ago. Say, I've done a couple actually. How long do dissolving sutures take to dissolve, and what's the cost of mole removal? Both of them were like this. Someone's asked that question, and then I have to answer it on the live Q&A, and then we post it on YouTube as a video saying cost of mole removal, or how long do dissolvable sutures take, or like this one, how long does it take for a scar to fade? And then everyone berates me because I don't give an answer. You know, they're like, well, he hasn't told us how long it takes to dissolve the suture. He hasn't told us what the cost of mole removal is. He hasn't told us what this is. And I'm like, because the fact of the matter is, most of these things, the answer is, it depends, which is very unsatisfactory, I do know. But it does depend. It depends on the site of the body where it is. So around your ankle heals very slowly and has got a poor blood supply. Your face heals very well and will heal more quickly, and the scar will fade more quickly. It depends on your age. You heal more quickly as a young person than you do as an old person, but the scar fades better as an old person than a young person. It depends on how much tension's on the wound, so how big it is. So moles are skin lesions, so we take out skin. Cysts and lipomas are subcutaneous lesions, so we don't take out much skin. So hopefully a cyst or lipoma, the closure wouldn't be too tight. But a mole, you might have tight closure, which might make the scar a bit more red for a bit longer. It depends on how the healing goes. If you have delayed healing for whatever reason, bit of infection, it might take longer. It depends on your skin type. If you have a very pale skin, you might form scars that are a bit more red and take a bit longer to fade. Some people do make worse scars than other people. There are people who do scar well and people who don't have good scars. So there's a variety of factors which will come into it. But what I normally say as a kind of ballpark answer for these sorts of questions is that the skin's healed in a week, and that doesn't matter if you're having a mole removed or having a tummy tuck or you're having a facelift or you're having a, you know, whatever operation you're having. Basically, the hope is that the skin's healed in a week, pretty much. I mean, obviously you can get problems with delayed wound healing, but the idea is that the skin should be healed in a week, but it's not very strong, so you leave it a few months before you do anything to it. And often, if you look at it a week, it actually doesn't look bad, and you look at it at 6 weeks and it looks more red. So they often go more red before they go less red. So if you look at it a week, you think, oh, that's a good scar, happy with that. And at 6 weeks, oh my God, it's all red and hard, and you know, because as the scar gets stronger, it gets more red and a bit more lumpy, and then it fades. So I normally say 3 months is the sort of time scale I give. For 3 months, when things start to fade, that's when things start getting better. We talk about scar management, massaging the scar and what have you. We'll talk about that in the clinic, but basically 3 months is where it starts to fade, and then it's 6, 12, 18 months for it to properly fade. So again, broadly speaking, a year is kind of like the time that most people would say is when you're fully faded, but it's sometimes 18 months, you know, sometimes it's still a bit red at a year, so you can't 100% say that about everybody, but broadly speaking, a year is kind of what you're looking at in terms of the fading, and what have you. And so yeah, 3 months for it to start to fade, 12 months for it to properly fade is the short answer. So